Hello, and welcome to Corporate Insights review of maternity patients' journeys from the first trimester to postpartum appointments. In this webcast, we'll highlight key findings and recommendations from our new study, Maternity Care, the Patient Journey. I'll start with a quick overview of Corporate Insight. Corporate Insight is a research and consulting firm that provides competitive intelligence around the digital user experience to the nation's leading health insurers, hospitals, and financial services firms. Our health system monitor research analyzes the web and mobile user experience that health system organizations offer to patients. In this webcast, we examine the insights from our maternity study in which we conducted in-depth user interviews with maternal patients. We highlight user expectations, successes, and areas for improvement along their experiences from the first trimester to postpartum care. On the right, you can see which hospitals and insurers that participants used and spoke to us about. For this study, we completed one-on-one interviews with maternity patients from across the U.S. To qualify, patients were either pregnant at the time or had given birth within the past year. We discussed key areas such as appointment scheduling and educational resources, as well as gaps, wishes, and successes for all key areas. We found that direct appointment scheduling and communications are preferred. In terms of scheduling in-person appointments, most patients schedule their next appointment at the end of the prior one and claim it's their preferred method. Some patients reschedule over the phone with the receptionist or scheduling department. A few conveniently manage appointments via their clinic or hospital's online portal. Patients find appointment reminders via email and/or text helpful. They also find having a direct care team member's phone number and OB explaining the next appointment steps very useful. While maternity care patients rarely experience telehealth appointments, they are open to them for various reasons, such as postpartum or non-physical appointments, medication refills, and symptom-related questions. Some respondents would consider telehealth due to the convenience and to avoid long in-person wait times, long travel times, physically going in when it is painful during recovery, and finding childcare or having to take children with them in person. Next, we found that all interviewed maternity patients reported at least one success during their appointments, which include strong communication with staff, the ease of scheduling or rescheduling appointments, convenience of completing labs and tests at the doctor's office. Some felt their appointments were successful when they left feeling confident with all of their questions answered. Gaps include the need for more frequent appointments, check-ins, or testing to receive peace of mind. One patient described wanting more scans and tests to check on their baby. For patients receiving care at an OBGYN clinic with multiple providers, they often had little control over which provider they would see from appointment to appointment. Some respondents appreciated the opportunity to select one OB after meeting with them all to build rapport and feel autonomous. A few patients understood the need and preferred to meet with every OB in case the one that they wanted was not available to deliver their baby. Regarding educational resources and tools, we found that providers distribute a range of forms and materials for patients throughout their care. Most respondents receive physical and electronic educational resources at the beginning, while some receive them throughout their care. Providing all information in the first trimester may be overwhelming, thus, it is recommended to provide such resources throughout care. Giving printed information, brochures, and birthing plans based on discussions were comforting to patients. A few respondents did not personally receive such educational materials, but had to proactively take them from the office waiting area. Also, continued education is important and needed during postpartum and recovery. Patients rarely receive educational materials during postpartum care, and respondents commented on the fact that it is essential for recovery and proper healing. One user received unique and helpful resources via a TV monitor during birth and in the recovery room. She and her partner were able to watch educational videos on topics including medications, prescription refills, classes, discharge plan, and pre-selected education. Another participant commented on the lack of education on prenatal tearing and recovery in the U.S. Pregnancy tracking apps offer extensive capabilities and features that organizations can look to for improving patient portals, such as developmental milestones for baby and your mom on a week-to-week basis with visuals as we see in the Baby Center app. Logs and trackers to monitor personal health and wellness data like hours slept per night and share that with others, such as shown in the Flow app screenshot. Also, online communities, message boards, and chat options to discuss pregnancy with other expecting parents was an important feature which we see in the What to Expect app screenshot, as well as interactive tools including to manage well-being or creating actionable goals. And lastly, a notes section within the patient portals which could facilitate a quick information sharing with providers. In terms of support, patients mentioned strengths and gaps which impacted their overall experience. Some mothers fondly recall specific providers such as nurses. Most respondents strongly value personal, direct, face-to-face support, preferring it over remote or impersonal support. However, maternity care support gaps exist across different providers such as clinics, hospitals, and insurers. For example, clinics offered limited take-home educational resources. Hospitals adapted only a few classes to virtual formats, and insurers failed to communicate support programs available. Overall, with COVID-19 restrictions, patients felt a lack of support during in-person appointments when partners were not able to attend, and many felt gaps in postpartum appointments and support after birth. These are some of the key recommendations from across our 5 areas of focus. For example, providers can offer expecting mothers the option to complete telehealth appointments for all non-physical and postpartum check-ins, questions, or postpartum depression assessments. They should also offer online portal access and in-person appointments to receive test results. Leveraging existing patient portals for education and support resources would provide an all-in-one experience for patients. To get a further understanding of these recommendations, Please read our full maternity study report, which is published on the Corporate Insight client portal. For more information on our best practice recommendations or health system monitor research, please contact us here. Please reach out to us with any questions about Corporate Insight and our research services, and schedule a free consultation with the contact information on the screen here. Thanks for watching.